Then welcome to the Renfert Experts webinar series. Good evening in India and Asia Pacific. Also good afternoon in Europe, near Middle East and Africa, and as well good morning in North, Middle and South America. My name is Renfert and I am head of dental education for the company Renfert. Today, with my great pleasure, I would like to welcome Mohit Suryavanshi. I hope my pronunciation was okay. From Kolhapur, India. Kolhapur is located about 400 kilometers south of Mumbai in the west part of India. Mohit Suryavanshi is an experienced dental technician since more than 20 years, and he runs his own boutique dental laboratory in India. And also he is a course lecturer and also speaker at dental conferences. Mohit Suryavanshi present today and in India this evening the art and science involved in a dental laboratory procedure. Okay, now look forward to an exciting presentation and hand over to you, Mohit.
Thank you, Manfred. Okay, welcome all. Just the first slide to introduce India, and I hope everybody is very curious about India. Many of them have traveled and visited India. This is just a hello from India. The new hello now is not a shake hand, but a namaskar. In these, nobody's gotten a bite in the last 3 months. Business is absolutely at the low because the patients are being safe, so are the dentists, and so is the dental lab. Am I audible? Am I clear?
We have a little bit, I think the internet is not perfect, but your voice is clear. Yeah.
Oh, is it?
Yeah.
Okay.
But go ahead.
Okay. Yeah. Sorry. Okay.
Mohit, we have problems with internet. It's always stocking. Yeah.
Now, is it? Can I?
Try it again.
Is it clear?
Yeah. Open your screen.
You see the screen?
Yes. Yes. Yeah. We see the screen,
Perfect.
but it's before it's not running. Now it's okay, I think.
Okay. Fine. Sorry for the inconvenience. Yeah. So the topic for today is the art and science involved in the dental laboratory procedures. And the image that you see on the left hand side is exercise that we often do in the lab, wherein we try to mimic a natural tooth. It's a small toothpick on which we would sculpt a natural tooth. We'd like to mimic a natural tooth exactly the way how it is in the same dimensions. And that's what gives us more information about the natural tooth. And to introduce myself, I'm a dental technician in India, and I am practicing in my own dental lab since 1996. A few glimpses of my lab. It's situated in a town called Kolhapur, which is south of Mumbai. That's my lab. That's the entrance of my lab. That's my team that you see. That's the cabin on the right hand side. And we have periodic exercises. We have periodic workshops going in-house. And on the right hand side, you can see the place where I document my cases. I photograph. And that's my team. And that's an image when we took during one of our workshops, wherein we have workshops, a workshop wherein we do some sculpting on the clay and also sketching to understand the tooth shape and the tooth morphology. So the entire goal for us is to achieve aesthetic success. And for that, what is important is to learn and to understand the tooth shape, the color of the tooth, and the surface structure or the micro shape and the glaze to make the tooth look as natural as possible. So for that, we need to study so many things like the age of the tooth, which makes a significant difference on the overall aesthetics. The shape as well as the color is all influenced by the age of the tooth. And only then we are able to achieve these kind of lifelike aesthetics in terms of the shape, the color, and the micro texture. Because you need to have a lot of study of the natural tooth in terms of its function, in terms of the overall aesthetics, and is it like that, and why has the nature created it like that. It's just not copying the nature like that. You have to understand the nature also, observe and then understand, and then we have to copy the nature. So what looks like this on the cast, we just wish that it nicely disappears and nicely blends into the natural dentition. That's what the primary goal is. So what we try to mimic in the final ceramics, we should start exercising with the wax first. Hence, the exercises on wax plays a very vital role in every dental laboratory. People have started thinking that digitalization means it's getting rid of wax up, but as long as you are strong with your analog way, only then you will be able to replicate or achieve success the digital way. For that, you need to understand all aspects of the natural tooth. You need to see, you need to study all these line angles, the transitional line angles, the eggshell twist, what the tooth has, which affects and which influences the overall axis of the tooth. You have to study the tooth from all aspects. So a tooth shape, when we have to study, it's more of the line angles and how it relates to the adjacent tooth. It's when we call this as a particular, we call this as a zone of excellence, because this is what really is visible in the patient's mouth. Of course, it should be functional. And for that, the more materials what we can get in terms of wax, this is the new Geo Expert wax, the August Bruguera set, which not only allows me to study the shape, but also gives me an understanding of the final color. We can have all type of nuances added just the way how we add into the ceramics with this wax set. It's a real pleasure working on that. And on the gadget on the right hand side is a must-have gadgets. It's a must-have gadget, and it's the wax electric from Renfert, and we have almost 10 in our office. And this is the best instrument that everybody should possess to exercise, to learn, and to wax it up. Okay, every natural tooth. And this is how, these are a few things wherein we try to manage with the shape, we try to achieve the color also, we try to also study the texture on this, all aspects. So rather proceeding straight away to the ceramics, it's a nice experience that you could do with this wax. Absolute true to life aesthetics you can achieve. The best thing about this wax is reasonably priced than ceramics. You can have all possible optical views of what you're going to wax it up, and then you can mimic it into your ceramics. Maybe it is a lithium disilicate or it is a layered ceramic. So Renfert plays such a vital role because it has eased our everyday working. It has given us so many materials and also so much of equipment that life becomes really easy. After the shape, what is life without color? So it's the color that plays a very vital role, but primarily it comes the shape. If the shape is not correct, then color won't take that much of importance. Okay. And then finally the texture. Whichever material you are using, you need to achieve the right kind of texture. You might be using the high performance polymers today. Sorry, you might be using resins, you might be using ceramics, you might be using zirconia, but the tooth should look like a tooth. Material choice should not be an excuse. So we should be able to exactly mimic what a natural tooth replicates on as a in the restorations that we are making. May it be a implant supported tooth or it be a regular tooth. So texture is also so very important. What we can also achieve, we can also try to study it in the wax form. The seasons of life, as I explained it to you, the personality and the seasons of life, the age of the tooth also shows off a lot of wear characteristics, the intrinsic color, the stains that have. So the study of a natural tooth once again plays such an important role. So based on all these things, we are going to start with a few cases wherein I would like to show you how we treated those cases and how so many materials that we have eased our overall working. Because our ultimate goal is to achieve the shape, texture, and the color. So what you see on the left-hand side in the form of shape, if you're getting the color that complements to that, then it's the best thing that a patient would like to have would like to wear, and it's a big compliment for us, and it's a feather in our cap. So to start with the case, it was one case wherein the patient was wearing these porcelain fused to metal crowns, which were not up to the mark, and she was quite a charming lady, and she had some expectations. This was earlier preparations. The case was treated by a dentist friend of mine, and the earlier restorations were removed, and extreme left, what you can see is after the immediate removal of the restorations, a proper treatment and a proper contouring of the preps was done, and then we had a wax up done, on which basis you can see there is a silicon matrix. By we had approval of the patient by seeking her approval of the dimensions and the overall aesthetic how it looks pleasing for the patient. And once she was happy, we start with the processing. We usually have all our models done on this auto spin, which is a very very convenient model system. It makes your model look so beautiful. At the same time, it has a lot of ease of use. We follow all the protocols of mixing the right powder and liquid ratio, which makes the model just perfect the way how the dentist has taken the impression. There is no dimensional instability. If you follow all these protocols, then what you get is a perfect replica of what the impression has been taken. And that's how a model has been made. Every detail has been perfectly registered. Then the ditching has been carried out. Even though there is a veneer, if it's a crown, we make sure there is a split model that has been made. These are small handy tools which come to so much of use. It's your choice if you want to do a mechanical separation of these dies, or if you want to go with this hand saw. So that's how we could achieve. So what efforts the dentist has taken in taking this beautiful impression, we could replicate the right kind of dies, because there is a lot of work to be done on this now. Then comes right kind of patterns. Right now we are talking about more about the analog way. We start with the wax up. We use the August Bruguera set. We just try to see what all we can achieve the way what we want to achieve in ceramics. You can see the lobes that we have created in wax. It's the same way how we do the cutback for the ceramics. We will incorporate some materials, the blue, the opal, and we would achieve something of that sort. So once again, to introduce this set, it's so beautiful, and you can put all your imaginations to work. It has the mahogany that is required. It has the orange, it has the blue, it has the white, which can add some high value to your restorations. We build all these restorations in this wax. We finalize the contours, and now our job is to exactly replicate them in the form of lithium disilicate. So if you can see, we have tried these wax patterns also on the control model, which is a non-die cut, to have the right kind of emergence profile. And then we choose the multi-ingot from Ivoclar, wherein that's a different, you have your own information about the multi-ingot. It has a gradient in that, wherein you have a dentine as well as the enamel. This is one kind of spruing. Earlier slide shows you a different kind of a spruing. Sorry. Yeah, this is a very peculiar kind of a spruing, only meant for the multi-ingot. And the regular spruings that we use for our regular lithium disilicate or the porcelain fused to metal restorations are these. And most importantly, like all these factors, whatever we are fabricating in the lab, the casting, pressing, and the injecting protocols are the most important, but they still remain underestimated. We don't give it the importance that it is required, because these are the factors that make your restorations, that's the base of the restorations. Okay, so we chose this furnace, which really helps us out in this new era of digitalization, where we are doing a lot of 3D printing and wax milling. I will explain it to you later on why this Renfert magma plays a vital role in my lab. So if you have this 3D printed restoration, and if you want to exactly replicate it in the form of casting, the burnout of this resin is so very important, and it is not possible in a regular furnace. You need to have a furnace which has various stages to achieve these kind of precision castings, and also you need to have the right kind of result. If you can see the result of these castings, you can see they are so crisp, and that is only possible with the right kind of equipment, the kind of wax that you use, the kind of screwing technique that you use, and the kind of preheating protocols that you use. And that results into these kind of precision castings and also the precision pressings. They are not accidental. Okay, they are absolutely planned well. You can imagine we achieving these many restorations from one ingot. So that is only possible because we are following all the right protocols in the laboratory. After the pressing or the casting is done, what is most important is to have a fine sandblaster, which is generate less smoke and work more efficiently. And the technique how you sandblast is also very, very important. You have to have your jet exactly at the 45 degrees angle to achieve the right kind of retention, what you're seeking for, what the kind of abrasion of surface what you're looking for. After the sandblasting is done, we use these discs to help us assist the easy cutting of the lithium disilicate as well as the metal. Then we do a micro cutback on the restorations, and it's time for some build-up. So we will always do some layering in small increments. We won't do a huge layering because already we are working on an aesthetic material. So some materials that you can see on that plate, these are the small materials that we used to add life to the restorations. It's just like some spice we are going to add to the ingredient just to add life to the overall restoration. We take the shape with this golden powder, which helps us exactly assess the right kind of contours, the line angles, the way we had planned. And now it's time to add some color. We had added the materials from inside, the intrinsic colors we can see very subtly placed. And now we need to do some external staining and a final glaze. So it's more of painting, which we do more for the monolithic restorations. But of course, on these layered restorations also, you need to do some to add some more character. And we not only glaze, we also do some mechanical polishing over it, because to maintain the texture, this kind of texture that gives you a very nice light reflection, you cannot do a very high glaze. You need to achieve a satin matte like finish, and that is possible with these diamond polishing pastes. And that's how the case looks, even though it is nicely glazed, but it's not too shiny. It is looking quite lively. Okay, they are ready for etching. They have been etched, and my dentist sees some glaze that has been flown on the cervical areas, which is not a good sign, because in that area, because these lithium disilicate crowns will be bonded, and that area will be a weak link. There will be a leakage. The cement uh, won't be really efficient in that particular area. So this was pointed out to me. It was a shortcoming from our side. And after that, we have started to take a closer look under the EasyView 3D, wherever we get a chance to see this kind of a small glaze that has been flown in these micro areas. And these crowns have been placed into the patient's mouth. They have blended really well. And the reason to show you these images is these were personality related aesthetics that we chose. They were customized. The overall shape, the texture, and the color of the tooth was related to the patient's age and personality, which could make her more younger. And we had, like, a great case coming up on the screen. So that's how one case can be handled, and so many materials and so many equipment that come from various companies help us. There's one more case that I would like to show you, wherein we are working on, like, there are diverse, very different restorations in this. There are crowns. There is an implant crown. The dentist has worked really well on the emergence profile. He has created a custom emergence profile, which we have recreated in the form of a model with the perfect gingival mask. And once again, wax up is the most important thing. You do the wax up, it gives you a projection. It is your blueprint. It tells you how exactly are we going to go, how we are going to manage the papilla, because one is an implant crown, and we have to make sure that the implant crown blends really well with the natural teeth in the adjacent areas. So what was pressed, this is what we could achieve. So these are a few things. So creating the right submergence, the submergence profile is quite a task. But when you have the right kind of model done, and once you have the understanding of the natural tooth and the shape of the natural tooth, you can achieve all these kind of aesthetics. If I had chosen a triangular type of a tooth, then we would have had a negative space. There would have been a black triangle in that area. So what started here ended here, and look at the natural integration overall. And so when it comes to implant restoration, I used to have a very restricted vision, which now is no more. Like, I have this EasyView 3D, and I get to see a very large, I get to see so much of details of everything. Things have become really clear. And I used to work on this to do all the wax up and all, which practically I would say it's okay when you are conducting a workshop. But for my everyday use, it's more of inspection, doing a quality check, and gives me a very, very clear vision about every small detail of what we have. If there is any shortcoming, see, there are a lot of shortcomings in the lab, and it's not only showing you the best things that we have over here. It's not like that. A practical guy knows there's so many things happening wrong, and to inspect all that, you need to have a very, very clear vision. And this is what assists me really well. It's just handy, click it on and you get to see it 20 times bigger right on your screen. Okay, so this is a fantastic gadget, has simplified my life so much. So one more case I would like to show you, wherein we have done a full mouth rehabilitation the analog way. So that's how the images first came to me by email, and then came a note which the dentist prescribed. He had some requests about what has to be done. A very, very renowned and a very knowledgeable dentist, and that's, I'm very fortunate to work for likewise. So cases turn out really good. All the notes were followed. We had all the images from all the perspectives. This is what is very, very important, because I work primarily for distant dentists, and images and good communication is what is very important for me. We get the diagnostic models, we have the impressions, we get them poured, we have a Facebook transfer, we get them mounted on the articulator, and then we start with the wax up. I always choose the gray colored wax whenever I'm trying to do a diagnostic wax up. Whenever I have shape as a priority. Right now, when it comes to diagnostic wax up, is the shape that is the priority. Okay, so to understand the shape and the overall light reflections, the gray color is my color of choice. Even when we are doing 3D printed models now, when we have to do a digital mock-up, we choose the color gray again. We don't choose any other color, because in the color gray, now this is a 3D printed model on the right hand side. It's color gray. See how the light reflects, and you can get a very, very clear picture about what changes you have made to the original model. So coming back to the case, this is how we started the wax up. This is a initial addition, and we start adding more. We try to attain the right kind of incisal height that was lost, the vertical dimension which was already there in the patient's mouth, which in time being gone, it was lost. So nicely in the centric, the models were mounted. We tried to achieve the right kind of occlusion. We tried to achieve the right kind of buccal corridor, the midline. We checked the anterior guidance. We checked for the canine guidances also, the right kind of intercuspation. This is analog work. And this is possible once you have studied the natural tooth and how the form and function works. We send it to the dentist. He makes a silicon matrix. He transfers it into the patient's mouth. The mock-up is approved, and we are heading for the final restorations, which are going to be made, the anteriors primarily in lithium disilicate, and later on. So now we already had the information from the diagnostic wax up. So we have a wax injector in our office. So what we had worked earlier with the diagnostic wax up, from that we make a silicon matrix and we just inject the wax into the final model. So there is very less work, because we have already worked so hard on the diagnostic model that we don't have to once again do the same time consuming procedures. So you just inject, add some finesse to it. Of course, you need to add some finesse. You need to just carve them. You need to add some texture to achieve the final dimensions. Okay. And then they are ready for pressing. We're going to press them. The right, as I said, once again, the investing, the powder liquid ratio protocols also matter a lot. You need to understand when it's a veneer, when it's a crown, when it's a bridge, when it's an onlay, the expansion, liquid and powder ratios differ. Okay. We get the right kind of result. You can see how much output we have achieved from the ingot. So that's how reliably we can achieve. And whenever we are blasting this, once again the sandblaster comes into hand, and wherein we are going to do this cleaning with the glass beads, because this is lithium disilicate, and we are not supposed to, when we are reaching really close to these thin restorations, we should be playing safe, because aluminum oxide is a bit abrasive. You should choose over to the glass beads, and that's how they keep the shapes and the overall thin margins intact. We do a minimal cutback again. Again, the layering in small increments, as I said. And we use these ceramic plates. Okay, sorry, these wet plates for mixing the ceramic, because the main thing while you're layering ceramic is to keep the moisture intact. That is very, very important. If you lose the moisture in your ceramic materials, then the overall aesthetics of the ceramics goes for a toss. Okay, so whenever you are layering ceramics, make sure that your ceramic materials stay moist till the end of your build-up. You can see this is a small color coding that we have made to just to understand the high value materials or the low value materials what we have added. And we attain the final restorations. Once again, it is a age related, it's a masculine patient, it's a masculine look that we have given. The patient is male. Very subtle characterization, not much. Look at the shape of the canines and look at the texture. And now it's turn to go for the posteriors. After the anteriors have been bonded, now we go for the posteriors, and posteriors were made in monolithic zirconia, cubic zirconia. So there is no layering conducted on this. So this was the bite that we received, on which we did the scanning, we did the designing, and we got this restorations. We chose the right shade paste, we chose the right stain colors, and this is what we could achieve. The last tooth, that's the 7, is a Emax onlay, but you can just see how nicely the color of the monolithic zirconia and the monolithic onlay have blended. So what started here, this was the result. So we got to, yes, yeah. So we got to give back the patient his lost structure of teeth. Take an occlusal view, see the canine. See, so what started here, we could achieve this kind of a result. Everything was functional, all the anterior guidance, the canine guidance, and the overall form. So this was possible because we spent time doing the wax up with hand. And what you do with hand is really coming from your heart and your brain. Okay. So that was the result. This is what we could give the patient, the age and personality related characteristic and aesthetics. And now there is a revolution after this evolution. It's more of the milling, the digital way, the 3D printing, everything is come in. Life has become easy. If you feel so, it's truly become easy. But if you're not sound the analog way, then it's really not going to help you out. I have seen a lot of labs having really sophisticated milling units and 3D printing units, but somewhere they lack the analog way, and that's where the final product is not up to the mark. So we have these 3D printed castable resins, and we also have this milled wax, and which we have to replicate it now. So there comes the digital era where now we receive the intraoral scan. This is how an intraoral scan is received from a distant dentist almost 2000 kilometers away from me. Life is easy now. There is no need to post the case or somewhere. And we start designing it. You choose the right kind of library. You understand the soft tissue. You understand the hard tissue. And then you choose the form of the tooth. Then there's a 3D printed model that is printed on one side, and the restorations that we have designed are printed on the other side. They are printed in a castable material, but you can see the resin is in the color of green. But to add some life, it is very necessary to add some handwork to it. Only then the restorations look really natural. You just cannot print them and then you can go ahead. So you have those restorations printed, and over that you nicely do some layering or add some character with the wax. So that's where I was telling you about this preheating furnace. Whenever there is a 3D printed restoration, there are casting failures or pressing failures. I get a lot of calls from all across the country. I try to tell them this is the reason, because we are not following the heating stages. So you need to have a programmable furnace which gives you these possibilities of heating your investment ring in various stages. You cannot just put the ring into a very hot furnace and then you just go ahead with like you used to do with the wax. When it comes to precision castings and precision pressings coming out from the 3D printed resins, you need to follow all that. So this is the pressing result that we have. Just color it, that's all. This is a fully monolithic restoration. We have not even layered it anything with any material. Just the wax that we added on the 3D printed material, that's all gave us the final shape. And this is how it looks. We are waiting for the post-op images. Now I would like to show you something that is done the digital way. How we designed the earlier case, the full mouth case, the analog way with the right smile designing. We are going to do this case with a digital smile designing. So what happens is we receive this model with the right kind of information, the Facebook transfer, and we get them mounted with the right centric bites. And then we scan these models. We also turn on the virtual articulator because we are going to make changes into the overall situation. So you can clearly see the lost tooth structure is what we are going to give the patient back. We are going to correct his midline. We are going to add material to the buccal corridor, and we are going to give him a overall new vertical. Of course, the one that he had lost, which he had earlier. So we chose the right library depending on his personality. So this is how we have the side view, the occlusal view. If you don't have the understanding of the function, the analog way, if you have not practiced, you won't be able to replicate it the digital way. So it is very important that you do the exercises, and only then you'll be able to replicate. You need to have the right contacts. You need to have the right cusp and fossa relation. And that is possible if you practice it with the analog way. And over here, we choose the right midline. We choose the proper smile line of this patient. We have the perfect dimensions and the sizes of the teeth. And it is 3D printed later on. Okay, so what started here, with reference to the patient's smile and personality, we chose the library the right way, and then see the functional. And we printed the models once again. They have been printed in gray, you can see. And now they will be sent to the dentist, from which he'll create a silicon matrix and he'll do a test drive in the patient's mouth. So the mock-up was transferred and it was approved, and later on impressions have been taken for the making of the final restorations. So the right kind of models with the right kind of accuracy, having the margins properly exposed. And as I said, it's not only the die cut models, we also have to rely on these control models. They're very, very important, because once you are done the die cutting, the soft tissue relation is all lost. So you need to have a control model where it explains the emergence profile to you, and it helps a lot to us. It gives a lot of information about the relation of the tooth to the root. The restorations were pressed, and we have a minimal cutback over here. We add some subtle effect materials, that's all, and we complete the shape with the final enamels. Yeah, so once again, very masculine looking patient, and so we had to give him the aesthetics likewise. But life has become so easy. So what we started, they were ready to bond, and this is how they looked in the patient's mouth. We did not give him a very, very white looking and rounded teeth. Whatever we gave him was absolutely suiting his personality and his lifestyle. So it was absolutely as good as invisible. And that's what is the role of a dental technician. So in this world of CAD/CAM, a skilled hand with an excellent color perception will add the required personal touch to the restorations, okay? Ultimately getting them closer to nature. So shape and color, you need to have the right information, you need to have the right study. And thank you, Renfert. We appreciate your contribution towards the dental technology industry and making our work easy by giving us so much of excellent products and equipment. And I would also like to thank my mentors who taught me and who gave me a vision to craft restorations which are in harmony with nature. So, and also taught me to observe, understand, and then copy the nature. This is my contact. If anybody would like to get in touch with me, you're most welcome. On that note, I would like to thank you. It was a pleasure having you on board today. Thank you, Manfred.
So, thank you, Mohit, very much for your excellent lecture. You talked a lot of workflow, and what I saw, that how important it is to know all steps. Yeah? We have many steps to be successful, and not only one, there are many of them. And if we know all that, then we can have really nice restoration through to nature or functionally, and then the patient will be happy. Thank you again for this webinar, for your presentation. I hopefully see you soon. And also for next week, we have another interesting webinar with Zeynep Gönem. It will be the first woman. She's from Turkey, and she will talk about de-edging occlusion. This will be more in the direction of function. It's also very important. And it will be next Tuesday at July 21st. Sign up for it. Follow our Renfert Expert webinar series on our website, Renfert Dental, and also on our social media channels like Facebook, Instagram. Okay, thank you everybody, and Mohit again, thank you very much, and many greetings to India.
Once again, wish you a very happy birthday, Manfred.
Yeah, okay, thank you, bye-bye.
Bye.